Welcome to Funding with Trust, the podcast for people looking to have more impact in international development. Funding with Trust brings you candid conversations with top grassroots leaders in philanthropy and the non-profit sector on why supporting grassroots organisations is so important, what works and what doesn't, and best practices to help you make more impact in your philanthropic journey. And we continue to showcase the work of exceptional African grassroots organisations and hear from them on what can be done differently from donors and grantee organisations to cultivate lasting funding relationships. I'm John Deeks, together with Eve O'Mala, my co-host. Welcome to you, Eve, and lovely to be with you.
Thank you, John. It is lovely to speak to you again. And before we get into today's episode, I would love to share one of my favorite proverbs.
Oh, a proverb. I'd like that. Yes, go right ahead.
Yeah. So this goes like, every morning in Africa, a gazelle wakes up. It knows it must outrun the fastest lion or it will be killed. And every morning in Africa, a lion wakes up, knows it must run faster than the slowest gazelle or it will starve to death. So it doesn't matter whether you're the lion or the gazelle. When the sun comes up, you'd better be running. Now, John.
That is very, very true. Would you rather be the gazelle or the lion, Eve?
Oh, gosh, man. I thought about this for a bit. And the reason I actually brought it up is because it is so true for the leaders of the grassroots organizations that we're showcasing. And I would liken them more to a gazelle, because they are always running and running fast. They've got a growth mindset and they're always looking for opportunities to improve the conditions of people in their communities. And, they can't stop running. They can't afford to be complacent, because if you do, a lion will find you pretty soon, So you've got to be on the move at all times.
And this is why Funding with Trust, these podcasts, highlight some wonderful grassroots innovations and innovators in Africa. And one of those is Dandelion. And we're going to Kenya today. Just give me a bit of a background before we get into our interview.
Yeah, so Dandelion is actually one of those organizations that I've had a chance to visit. They are in Kenya, in a place called Mogotio, towards Western Kenya, really remote. But when you go to see their work in action, the work that they are doing is outstanding. The impact they have is so breathtaking. So we'll be talking to Wendo Aszed. She is the CEO and founder of Dandelion Africa.
And Dandelion have established healthcare centres and much more.
Yeah, they're doing so much more. So that is part of what they're doing. And they also go into these rural communities doing mobile outreaches. They've got a backpack nurse program. So these are different nurses carrying a backpack with all supplies, treating people door to door. And they've also done a lot of work around advocating for ending female genital mutilation. So they've been successful in eradicating female genital mutilation in 10 villages where they work. It is so impressive. And the one thing that stands out for me in what they do is that they engage boys and men in the fight against female genital mutilation.
Is the genital mutilation a religious core, have a religious core, or is it just part of their way?
Yeah, so it's a cultural belief that they hold in this part of Kenya. And I think Wendo is actually going to shed more light on it. So it will be, because she grew up in that community, so of course she would know more about it. But certain communities in different parts of Africa do practice it, but it doesn't make it right. It is a very painful thing to go through.
Of course.
And it is a lot what they're doing around here, and it is good to see that they're actually making progress.
Today's focus of Funding with Trust is a wonderful organisation called Dandelion, and we're going to be speaking, as you heard from Eve, to the leader of Dandelion. And Funding with Trust returns in just a moment. Here's another outstanding grassroots organisation, Safari Doctors, founded on the belief that access to healthcare is a right, not a privilege. Their team runs a medical centre and monthly mobile clinics where they travel by sea and road with boats loaded with medicines across at least 20 remote villages in Lamu, Kenya, and serve some 2,500 patients per month. Safari Doctors, another one of our outstanding grassroots organisations. On the line, we have the founder and executive director of Dandelion, Wendo, on the line. And Wendo, welcome to you all the way from Kenya.
Thank you, John. How are you today?
I'm very well indeed. And Eve has been telling me something about Dandelion, but I'd like to know something about you. What is your background?
I am a villager. I'm going to call it that. I was born in a small village called Wamwini in the western part of Kenya. I grew up and was raised by my grandmother. A few years later, when I was about 11 years old, I had an opportunity for an education. I think maybe you might be wondering, what does that actually mean? An opportunity for an education for me means that I finally got to go to a school with windows and doors, and I was able to wear my first pair of black shoes. And this was life-changing for me, John.
A pair of black shoes. Why have you remembered that, do you think, Wendo?
I think some of the things that come to mind when you ask me that question, why did this particular instant of my black shoes have such meaning in this conversation we are having today? I remember my first day in school. I wasn't actually able to speak a word of English. I was not able to write. And this was a problem because, you go through a lot of bullying when you're a child from the village going into an urban school. And through that process, I decided I was going to be the best English speaker in that school. And luckily for me, determination and resilience, I was actually able to be a really good English speaker. And hence, I'm able to talk to you today, John. So that's a little bit about myself and where I grew up.
Where did you go after your local school?
After my local school in Busia, I then graduated to high school. I went to a military school, actually, for my high school. Uh-huh. And then I went to university in Nairobi, Nairobi City. Then I came and moved to the current town in which I live right now. I worked in the banking sector for a couple of years. And certain events changed my life that drove me to start Dandelion Africa.
Wendo, before we get into the questions from Eve, who is champing at the bit and saying, Johnny Deeks, please be quiet, I can hear a rooster in the background. Paint the picture of where you are.
Thank you so much for your question, John. So I'm in Mogotio. This is a really small village. I'm actually in an arid and semi-arid region, so it's very, very dry. Mogotio is known for... I think you can hear the rooster again. So this is actually it's actually a village, and the rooster is so loud, and I'm actually sitting in a closet, just so you know, so for this interview. This is where people have small farms. We have cattle, we have goats, we have sheep, and I keep a few chickens out here for their eggs for my children. And yeah, that's the kind of lifestyle that we are in.
Wow, that rooster might be dinner today.
I'm Eve.
I think so. I might have to eat it finally.
So Wendo, that's a powerful story that you just shared. And you are a successful banker in Nakuru, and you quit all those luxuries, to go back into the village and work with women. Tell me more about that move. Why did you choose to quit your banking job back into the village?
I'm going to tell you a story of the shift that I made. I remember it was one Saturday morning. I'm sitting in my house. My best friend came to my house. This was unusual because he usually liked to visit on Sundays. And he was wearing this orange T-shirt and had this worried look on his face. I offered him a cup of tea, which he declined. So I sent my kids out to play, and I just sat there looking at him and wondering. But I had this sinking feeling at the pit of my stomach that something was wrong. So he looks at me and he tells me, Wendo, I just found out I'm HIV positive. I was so shocked. I was astounded because HIV was not even then at the time something that I imagined was among my friends or my peers. As a banker, you're oblivious to some of the things that happen around you. And so I went into my Wendo hat and started thinking to myself, how do we fix this? How can I help my friend? Just a little bit of my friend. He's the sort of person who would tell me things I never wanted to hear. That's why I was so close with him, because he was true. He stood by me and we were really, really close. It just so happens that as I was interrogating him and asking him, he started telling me about the issue that he could not get his retroviral medicine because the hospital had told him he has to wait until his viral load gets to a certain point. So he has to be sick enough to be able to get the medication. And he had been put on Septrin, which is an antibiotic. Unfortunately, 1 month from that day, my friend passed away of HIV complications. And that stayed with me. It sank with me. I was sad to a point of wondering, what is my purpose exactly? If I could not do something, if I did not understand how HIV was affecting the people around me, started looking around, started talking to my family and friends and asking what's going on. And I actually found out that so many people around me were dying of stigma and discrimination because of HIV-related issues. And that changed everything. So I made a shift. I talked to my husband, asked him for his support. I said, I could not live like this anymore. I needed to do something more. I was called for something more. And so I started studying about HIV. And I think the only thing I knew at the time was from movies like Phili Lutaya. We used to watch a Ugandan activist who was talking about HIV at the time. And that is how I started curating the idea of an organization that would work not just with boys or with men, but with communities on understanding the effects and solutions around HIV/AIDS. Yeah.
Wendo, I'm so sorry for your loss. And thank you for making that shift because you've impacted the lives of so many people in your community. The work that you do is really important. Thank you. So, Wendo, currently at Dandelion Africa, what programs are you running and how many people are those programs impacting?
Dandelion Africa reduces maternal and child mortality by providing quality and accessible healthcare to communities in hard-to-reach rural areas. As I said earlier, we work in arid and semi-arid regions. We have a medical facility. We have a backpack nurse model where we go door to door providing maternal child health services. We further work with an integrated model where we work with over 55 schools, and we're talking about over 10,000 students. We also work on issues of advocacy because issues of gender-based violence, especially female genital mutilation, are so rampant in our region. We work through a reporting mechanism, ensuring that women and girls are able to report these cases, and these cases actually go to court and convictions are made. Lastly, because everything we do is about women, we ensure that women have money in their pockets through saving groups, and they go through entrepreneurship training. One of the things that maybe I could talk about is the HIV aspect. We provide free quality healthcare to children under the age of 5, and we build a maternity center to ensure that there is no transmission of mother to child for HIV. So, and we have had none of that. So that is what Dandelion does and the back of why Dandelion was started.
And why did you choose to call it Dandelion?
That's it. That's interesting. I don't know if you have dandelions where you are.
I've seen stories and articles of people wanting to get rid of all dandelions.
I know. They call it a very stubborn weed. So we chose the name dandelion for several reasons. One, of course, it's beautiful like the women. Number two, it is and it represents the resilience of women. If you take it out today, the roots are so deep, it will come back. If you blow it, it will fly and it will grow somewhere else. And that represents the epitome of women and the power of women, especially rural women who are underserved and underappreciated and who take the bulk of all the work within our communities. So we call it dandelion because it is a representation of who women around the world are, Eve.
Wendo, what is your prime focus of Dandelion now?
Dandelion is a women's organization. Everything we do is about women empowerment. We run different programs to improve the livelihoods and the health of women. We ensure, for example, that women have access to sexual reproductive health. And when I talk about that, I'm talking about family planning methods. We go door to door through our health models to provide immunization for children, family planning for women. We go to over 55 schools to teach young people about their reproductive health. And this is encompassing self-confidence, self-esteem issues of female genital mutilation for young girls. We talk to young men as well, because we are firm believers that nothing will ever change if we only speak to one gender. We also talk to the whole community on issues of advocacy. Gender-based violence is such a huge issue around the world. And we ensure that we are talking to the community, because the community have called us to do what we do. So we talk to communities, we talk to chiefs, we talk to administrators, and we talk to them about what do we need to do to change and to make sure that the reporting mechanism of gender-based violence, especially female genital mutilation or female genital cutting, is finished within our communities. We ensure that women have money in their pockets for them to be able to thrive. You know, John, when women have health, but they don't have money, they will not have that health much longer. So everything I'm talking about today is about women initiatives, women empowerment, women's health. Women and girls need to thrive. So that is what we do at Dandelion.
And Wendo, roughly how many people are you serving?
We are actually serving a population of close to 1.3 million in total, because we work in 4 different districts. Yeah.
Well, that doesn't come cheap, Wendo. Do you get any government support?
We work very closely with the Ministry of Health and Ministry of Education. They offer technical support, but we do not get any financial support from any of the government ministries.
So how easy is it to get donors to support your work?
That's a very, very interesting question. What can I say? It is not easy. I think that as a grassroots organization, we're faced by many barriers. One being trust. As a small grassroots organization, funders will not trust you. They will wonder if they'll come to your foundation and find you shut down and disappeared into the bushes, right? There's also the issue of understanding. I think that a lot of funders don't understand that we are rooted where we are. We know and we live with the communities we have. We listen to what the communities need. We do what the communities want. And we are best placed to work on the solutions and come up with solutions that will actually change the lives of our own communities, because I am the community. I am living here. I understand. And I'm here every day. So that understanding is usually not there. It's this idea of models that work somewhere else that need to work here. So it is not easy, but I have been very, very fortunate to find like-minded funders who really understand community-driven strategies, who understand that you cannot, for example, provide a water tank and then expect an impact in 6 months. They understand that we need an integrated model where if you want women to thrive, you need to be able to give them reproductive health. You need to look at gender-based violence. You need to look at their children. Are they going to school? Are they empowered? You need to be able to invest in organizations like this for us to be able to build the level 3 health facility that we currently have, which most donors actually don't. So I have been very fortunate to have like-minded organizations that's helped us grow to the level in which we have, where we have a medical center with a maternity, one of the best maternity centers, if I may say so. We have a community library. We have a resource center. We have a hub where people know that they can get help when they walk through our doors. I don't know if I've answered your question, John.
Oh, you have certainly answered the question, and I think it's remarkable the holistic approach that you've taken to what are some very, very serious questions. Yeah. Over to you, Eve.
Yeah, and Wendo, that trust issue that you highlighted, I think I would love to touch on it a bit. You know, of course, we hear from funders that funding small organizations like yourself or local organizations carries political and financial risk and all these different transaction costs and the things that they highlight. And, you know, there's just so many words that they throw around, but most of the time, all of it points back to trust. So what would you recommend are some things that funders can do differently to build more trust for your organization? Because, you know, the work that you do, the impact is visible for everyone to see. It speaks for itself. So how do we get funders to trust grassroots organizations more?
I think that we have to recognize that grassroots organizations, we have some gaps, and that's a reality. the aspect of thinking that we need to be perfect competing with INGOs is a bit unrealistic. So we need to have sessions with funders who believe that they can build our capacity. I'm going to use the word capacity development, because we already have quite a bit of capacity. It's not that we are not educated, we are. The things that we lack are the things that are already coming from outside in. So the top-bottom approach is what is affecting grassroots organization. So what funders can do is invest in capacity development of grassroots organization. Have a very, very genuine conversation with grantees. Ask them, what is it that you need support with? Where are your gaps? And this should not be used to decide, like, I can't give you $10,000. I'll only give you $5 because I think you'll run away. Trust that I can do what I need to do. Because usually in our culture, Eve, as you know, when you trust me, I will do everything in my power to ensure that I never, ever give you a reason not to trust me. So trust, and also allow grassroots organizations to fail. And this is something grassroots organizations don't usually say, because we are so afraid that if we fail, you'll pull back the funding. Allow us to fail, because some of these models are trial. This is what community wants. Yes, we are trying it, but maybe we'll try it, but along the way, we need to pivot. We need to change how things are done because of even political, because of so many factors, cultural. Allow us to fail, allow us to pivot along the way. Everything should not be in stone. So lastly, it is the restricted funding. A lot of grassroots organizations are given restricted funding. You have to stick to the budget, but things really change on the ground. I'll give you an example right now. The fuel price in Kenya in the last 6 months has shot up by almost 40%. So if the restricted fund I was given, say, 1 year ago, surely things will change. Allow us to pivot. Trust that we are doing the right thing. Work with us, be our partner. I promise you, the impact will be very, very visible. So that for me would be my takeaway, and what I would ask funders to do. Trust us, open the lines of communication, allow for innovation. I'll even talk about reserves. I know a lot of grassroots organizations don't have reserves. If something happened today to a funder, for example, God forbid, what happens to that project? Allow grassroots organizations to grow organically, understand their model. And I think that is what we all want. We want a just society. We want things to change in the long run. So that is what I would say. If I don't know if I've answered your question.
That's very valuable advice, Wendo. That's really good advice. And I think if I can share my experience on this funder journey, for you to be able to build the kind of trust that you're talking about, or even be able to trust grassroots organizations to fail, you really have to be open-minded, be ready to start relationships with them, be ready to spend more time with them, understand what they do, see things from their perspective. And that's really how we build this trust.
Wendo, you come from a banking background. You understand how important it is to be accountable. How do you feed back to donors your achievements and how their donations are impacting at a grassroots level?
We've got different kinds of funders, but at Dandelion, we have structures in place. So our governance structure is fairly simple. We make sure that all our funders are up to date with all reports. So we do quarterly reports, we do interim reports, we do Zoom calls. We've got virtual site visits, which is really, really fun right now because nobody's able to travel, right? So the funders are even able to meet our teams on Zoom to discuss, to talk to them, so that it's not just talking to Wendo. They can reach out to the team and talk to them. We have videos and we create content that we send to our funders. Most importantly, the relationship we've cultivated with funders is very, very open. Where we feel we need to change, we just pick up the phone and we call. And I think that is one of the most impactful things I have seen in my 10-year journey running Dandelion Africa is the connection. Because in the beginning, John, I used to think a funder was a computer. I couldn't place the face behind this person who gives money and doesn't even know where this money is going. But right now, I understand that a funder, is a partner, is a friend. They've been to my house. They've seen my kids. They've come to Dandelion. They've met the community. So one of the way we are accountable is ensuring that we also do audits. The audit process is very, very important for grassroots organization. We have to make sure that we have our financial audited. We also share that. We share reports. We share stories of change. We do virtual site visits. So we do thank you letters. We meet them when they're able to come. We invite them to come and visit us. They visit our homes. They visit our communities. We are partners. We no longer look at these relationships as top-bottom, but rather like a very symbiotic relationship where we are serving purposes together in this world to change systems and to change communities. Lastly, Dandelion, for example, has what we call a community board. These are people who are living with disability, living with HIV, young people, school children in this community board. And they are the ones who advise the organization of what we need to do better and what we need to stop doing. And we share this with our funders. So we are a collective. And that actually ensures the impact is greater. And we are also looking at a more sustainable approach towards community-driven approaches.
And that's a powerful aspect of your work. The fact that the community also holds you accountable and takes ownership for these programs, I think is one of the reasons as to why you've been very successful. Now, Wendo, I know that a lot of your work, of course, everything you do is for women, centered around women. And you do lots of family planning. You do lots of information around sexual reproductive health. And you've provided a safe space for women to deliver their babies and not have to deliver by the roadside or in their homes. What would have happened if Dandelion wasn't in this community? Where would these women have found these services?
I can't even tell you if some of the times I think about that. I just want you to imagine a 25-year-old girl with 7 children, or a 17-year-old girl with 3 children, because hospitals are 18 to 20 kilometers apart and the infrastructure is really poor. If we were not here, the number of women, the 3,000 women who currently have businesses, sustainable businesses, would actually not have it. The level of HIV transmission between mother and child that has gone to 0 in Mogotio would not be there. The 10 villages that have stopped female genital mutilation would still be cutting girls till today. Over 5,000 children who've transited to the next level of education would not be able to do that. And lastly, for a girl like Joy Jelimo, who we started working with in 2014, who then became the first coder when she finished high school, got a scholarship to become a coder, and now joined the army, would not be able to do that. So there's so many things that would not happen because of that. I don't know if I've answered your question, Eve.
This is so powerful, Wendo. It is a lot of impact that you have created. And the one thing we've not even talked about the work that you do is that you engage men in championing women's rights and ending female genital cutting or mutilation, which is really fascinating. Why do you think that it's something that not many people are doing, engaging men in this conversation? And why did you choose to engage men as advocates for this work?
I think most of the time we do not focus on the obvious. That is how I look at life. I am very simplistic in how I look at issues. We tackle girls' empowerment. Around the world, it is, and it has been about girls' empowerment. But the real issue is, why are things the way they are today? Who makes the rules? If you look at all systems, it is men who make most of the rules, who make most of the policies, and we follow. So isn't it obvious that we need to be talking to men so that they can understand the challenges women go through and they can make provisions and support? Mm-hmm. Yeah. So for us, engaging men and boys into the issues of female genital mutilation is so imperative, because it is the men who say they will not marry women who are not circumcised. So the circle will never end if we are only talking to girls. So engaging men and boys has actually been the greatest impact and the special source of Dandelion Africa, because it is the men who've now said, We no longer want female genital mutilation in our communities. We no longer want issues of gender-based violence in our communities. So that is why.
Wow.
Wendo, where do you see yourself and, in fact, Dandelion in 10 years?
We believe in lifting as we climb. So in 10 years, we would like to be mentoring other community-based organizations. I believe that as an organization, I might not know what people in the north of Kenya or in the south of Kenya need. So we intend to mentor other grassroots organizations like us because we understand the struggle of grassroots organization. But we also believe that those in those regions are the ones who know what they need. But they don't have the opportunities that we have been accorded, the information, the capacity that has been developed. So we want mentors. We want to mentor them, and we want them to fly like the dandelion. Thank you.
Eve, this has been extremely instructive to me. Wendo, thank you so much indeed for giving up your time so early this morning in Kenya. Thank you so much for the hard work you're doing. You could have had a very good life as a banker in a big city, but you've chosen to go back to grassroots, and we thank you so much as founder and executive director of Dandelion. Stay well and look after that rooster, which I think has taken off.
It's in the kitchen.
Thank you so much.
Thank you, Wendo.
It's in the kitchen. Thank you, Wendo, and be well.
Thank you, John. Thank you, Eve.
Eve, that's just another great example of the grassroots organisations of which you speak. There must be so many.
John, there are very many of them, and we need to find them. And once you do, it's like finding a hidden gem. They go on to do such great things and impact the lives of so many people.
Well, I look forward very much to you introducing us and to our listeners another great grassroots organisation who are making an impact on a very local level. So I look forward to talking to you next time.
And thanks everyone for tuning in. Thank you, John.
To support organisations just like you've heard from Dandelion, please visit our website. All donations within the US, Australia and Europe are tax deductible. You can listen and subscribe to Funding with Trust on Spotify, iTunes, Google Play, or go to the website fundingwithtrust.com. And please join us next time for Funding with Trust.